Nisargopachar Kendra Vinoba Ashram Gotri Vadodara welcomes you. This deliberation was made by Dr. Usha Vastare during National Convention on Gandhi and Health on 19 January 2020. Distinguished neuroscientist Dr. Usha Vastare is a founder of YogaKshema Foundation, Bangalore. YogaKshema Foundation is known for its training program based on modern neuroscience and spirituality and evolution of human mind. The topic for her lecture was quality of death and dying.
Namaste. Good afternoon to you all. Discussions on death and dying are culturally considered as a taboo and forbidden topic in many countries, including ours. We all wish, hope, and pray for a pain-free, dignified death when our time comes. But too few of us achieve it. This talk is an attempt to look at death and dying from a perspective that gives us a lot of hope. Yes, topic like death and dying will and can give a lot of hope and also empowers us in the way we look at death and dying. In other words, this talk is all about how we choose to live all the way to the very end. So, how do we achieve pain-free and dignified death and lead a purposeful life until the very end? This talk attempts to inquire into these aspects from three different angles. How do we improve our quality of death and dying by gaining knowledge of comfort care and end-of-life care of life-threatening illnesses through relief of pain and suffering and treatment of other problems related to physical, psychosocial and spiritual wellness? This is nothing but palliative care and hospice care. The second angle, can we take away the responsibility of making decisions about death and dying from our near and dear ones, and maybe also be some support and assistance to the public at large even after death? The third angle is my own personal underpinnings and the philosophy of YogaKshema, an organization which mainly focuses on improving quality of life. So how can we improve our quality of dying by understanding certain issues associated with dying? In the current technological era, the medical fraternity seems to be overly focused on quantity of life with little concern for quality of death. This reminds me of a famous quote by Abraham Lincoln. It's not the years in your life that counts, but the life in your years. Death and dying are multidisciplinary subjects. In order to enhance quality of death, we need to engage with diverse specializations and experts like policymakers, regulatory frameworks, insurance agencies, lawyers, academicians, board of studies, and of course, social scientists and the entire community at large. We need a multi-pronged approach so that we can freely talk about these aspects in the most sensitive way and educate our citizens on the same issue. The very first question one has to deal with is, should people be told that they are dying? An important question. If so, how so? How do you tell someone that they are dying? Without the knowledge of dying, how can one make decisions about one's own health issues and one's own treatment? In our culture, where death is often a taboo subject, many consider talking about death as rude and disrespectful or even ill luck. In our culture, mostly the male head of the family takes over the role of making end-of-life care decisions for seriously ill family members. Many a times, some may even actively protect dying family member from knowing the truth. Apart from the cultural aspect, one of the main reasons in any culture that death and dying subject is not approached is because of fear. From my dealing with ill and dying patients, my answer to this most often asked question is an unequivocal and unambiguous yes. Should somebody be told that they are dying? Absolutely yes. Except in certain cases which we are not going over here. And if so, how? How, you may ask, how do you tell a person that he or she is dying? And my reply is, as sensitively, as quietly, and as kindly and skillfully as possible. The key word here is skillfully. According to Dr. Raj Gopalan, who is the father of palliative care in India, just as a wrong dose of a drug can harm, so can an ill-chosen word. However, when it is done as skillfully as possible, it should lead to carry the relationships of their lives to true conclusion based on authenticity and unconditional love. Not only that, this will lead to resolving many practical issues, and even more importantly, they can actually help their loved ones who will be left behind after their death. This is how we can prepare them for death. Otherwise, the lack of honesty will make them feel anxious and more isolated, as most, if not all of them, can sense instinctively the inevitability of the imminent death. So, I strongly feel that the truth has to be told so as to help them prepare for the beautiful aspect of one's life, that is having meaningful and loving relationships with people. This gives them an opportunity in the most inspiring and moving way to change themselves through their own inner strength and to be truly evolving so as to feel they have lived a fulfilling life. While all these at a personal level, Let us see what happens at the level of the care providers like the doctors. This is where I would like to introduce the subject of palliative care and hospice care. I am told even the doctors are not trained or trained very little to deal with dying when it comes to informing either the person who is dying or the family members. The doctors are mainly taught to see only the disease and not the human being who has it, says Dr. Rajgopalan. A doctor can play a crucial role in this regard and to deal with the fear of death itself. For most people, more than the fear of death, it is the fear of unknown, and even more than the fear of unknown, it is the fear of increasing and uncontrollable pain, fear of suffering, fear of dependence, fear of separation, fear of losing control, fear of losing respect, fear of humiliation, and perhaps the greatest fear of all is the fear itself, which has a snowballing effect and grows more powerful as we try to evade it. Of all the fears, fear of uncontrollable, unending pain is by far the most prevalent and powerful. This is where the physician's role in educating the family about palliative care and the hospice care comes into play. In my opinion, although palliative medicine is a field of expertise, primary palliative care is a skill that all physicians should have, as integration of palliative medicine in patient care across all fields of medicine is known to relieve patients' distress as well as improve the quality of life. I would like to spend a few minutes on this important concept which is directly related to the quality of death. Briefly, while both palliative care and hospice care provide comfort, palliative care can begin at diagnosis of an illness and even at the same time as a curative treatment is going on, whereas hospice care begins after the treatment of the disease has stopped and is reserved for terminally ill patients when the treatment is no longer curative during the last 5 or 6 months of life, assuming the disease takes its normal course. Palliative care involves a multidisciplinary team including the patient, family members, palliative medicine and palliative care physicians, nurses, social workers, pharmacists, clergy, counselors, speech therapists, physical therapists, occupational therapists, dietitians, and volunteers. Palliative care in India is a relatively new concept, having developed only over the past 30 years compared to 50 years in the developed nations. The number of people dying each year in India is close to 10 million. Assuming 60% of all those who die are in need of palliative care, the number of people in need of palliative care is about 6 million in India. This translates to less than 2% of the needy have access to palliative care in India. Currently, there are about 900 to 1,000 palliative centers in India. out of which 850 centers, about 850 centers are in the state of Kerala. That's where Dr. Rajgopalan is in the state of Kerala. These close to 1,000 centers are accessible to less than 2% of the total population of India, as I already mentioned. And over 90% of all palliative care programs in the country are available in the state of Kerala, with only 3% of India's total population. Even though Kerala serves as a WHO model for palliative care services for the developing world, the rest of the country is still lagging behind. As a result, India ranks very low in a study of quality of death conducted by the Economist Intelligence Unit in 2010. India comes near the bottom of the global league in access to the end of life care and is ranked 67 out of 80 countries according to a study on quality of death index commissioned by Lien Foundation in Singapore, conducted in 2015, just very recently. Whereas UK ranked first and US ranked 9th respectively, whereas India ranked 67 with respect to end of life care. Central to the provision of care for the dying in order to improve the quality of death in pain relief, which is far from being satisfactorily achieved, alleviation of pain is closely related to every human being's right of dignified death. Although allowing death to occur in the comfort of a family setting matches with our culture and our values and beliefs, many people in modern times spend their last days and hours of their lives in futile care of curative treatments only to prolong suffering of the patient and family members in the guise of saving life. This only amounts to prolonging death rather than saving life, something to ponder upon and reflect. The goal of hospice care is to provide comfort and quality of life through alleviation of pain and to shun away from aggressive, futile care at the end of life, so as to provide a familiar and comfortable environment for people suffering from terminal illnesses to have a pain-free and dignity in death. Dignity in death also comes from accepting death as an inevitable part of life and not as a failure of doctors and healthcare system to successfully cure. Again, something to really ponder upon. The purpose of my talk is also to propose to the community at large, doctors from all systems in particular, to look into the aspect of palliative care in general and hospice care in particular, to be able to follow the principles of palliative care, advocate for the same, work at the level of policy making, to do capacity building in order to bring awareness for the general public, and to be able to be involved with training of doctors, nurses, therapists, counselors, and volunteers, and finally to be a part of implementing the policy. By making active decisions in the last stage of our lives, and not in a passive manner because of fear or guilt, is how we can improve our quality of dying, is my humble opinion. Because so far there is hospice care, and the policy they have implemented mostly in 3 major states. First, it started in Kerala, then in Maharashtra, and later on in Karnataka. This brings us to the next aspect of my talk, which is advanced care directives. This aspect, though very much a Western concept, I'm going to interpret from our cultural perspective with a spiritual twist to it. But first, what is advanced care planning? When we have to face big and significant decisions in life, it always helps to think ahead, plan ahead, taking many things into consideration. For example, when do you switch your career? When can you afford to buy a new vehicle or a new home? Can you afford to retire? And where to live after retirement? We plan for all of this, but yet we shy away from certain crucial decisions, like what type of medical care do we want if we get into a situation of having a chronic illness, or if we are too sick, or if we are too injured, or even too confused to voice our wishes. Surprisingly, even in the USA, 70% of all Americans, adult Americans, have not discussed or documented their desire for medical care in the event of serious or life-threatening illnesses. While we may be able and hale and healthy today, we never know when we might get into emergency situations like an accident or a stroke, or might be temporarily incapacitated and restricted. Conventional wisdom imparts, at the very least, most of us will experience declining health, which might leave us unable to make decisions at the right moment. Even though it's not something that anyone wants to deal with, imagine that you or your loved one has a serious and progressive condition or illness which will make one less and less likely to communicate one's wishes. Then who will speak for you? Who will decide for your medical care needs? And what will that person decide the kind of care? And will that person decide the kind of care you would have wanted, or you would have decided, or you would have asked on your own? This is the concept of advanced care planning. Advanced directives are instruments that translate your wishes into documents that allow you to describe what kind of medical care you hope to receive if an accident or an illness renders you unable to communicate. There are 4 advanced directives that are involved. First one is the healthcare power of attorney. Secondly, the living will, the do not resuscitate order, DNR, or in India it is called DNAR. And last, POST, physician's order for life-sustaining treatment. This is a very newer approach for life-sustaining treatment. Without going into great deal about each one of these directives, I will touch upon one main valid concern, but a misconception that filling out these documents means giving up control over one's medical treatment. However, in reality, advanced directives will help you gain control over your medical care. whether we have thought about it or not, when we are unable to make decisions for ourselves regarding healthcare, someone else will surely do this for us. Advanced directives will help you to choose the person or persons who will make the decisions for you only, mind you, only when you are not able to do so. A reassuring factor to know that based on a review of 113 research studies on advanced care planning, it is established that it improves the quality of people's dying days and leads to less unwanted and unneeded hospitalizations in favor of symptom relief, comfort, and use of hospice care. In my opinion, advanced care planning and documenting the wishes is crucial when one is confused and troubled about making a distinction between organ-sustaining versus life-sustaining treatments. What do I mean by that? Most of the times, when healthcare providers discuss about life-sustaining treatments, the treatments themselves are intended to bolster a single organ whose function is profoundly impaired, like artificial ventilation, cardiopulmonary resuscitation, hemodialysis, to name a few. Whether a treatment will simply support that organ or will help restore a person's health will depend on whether an organ failure is temporary or permanent, and also on the overall health of the person. This is a crucial aspect to be educated upon in this day and age of a technological era, because it is possible to keep a person alive. Technically, it is possible to keep a person alive long after being brain dead. We are coming to the last part of the talk, that is the personal underpinnings and also the philosophy of YogaKshema, an organization that works on enhancing quality of life of people, as I mentioned earlier. Before we go there, let us see what Kathopanishad teaches us. In this Upanishad, Yama teaches Nachiketa that it is necessary to understand death to understand life. This also infers that it is necessary to understand life to understand death. So let us look at this through an experiment that was done as a university class project in US. When few hundred university students were asked what they would do if their physician were to inform them that they only had few months to live. These university students were asked what they would do if they only had few months to live. The students started naming items of their bucket list, which was mainly about visiting places or doing some fun-filled activities. The same students, when asked what they would do if they only had few hours to live, few days to few hours, after an eerie kind of silence in the room, most of the students spoke out about spending time with their loved ones or wanted to spend time alone in prayer, in communion with the higher source. Mind you, These answers were not given by sadhus or sannyasins, but these were given by university students in America. So this awareness that our time on this earth is not infinite becomes connected to the preciousness of each breath, preciousness of each thought, and preciousness of each action. Yes, a shift happens. A shift from thinking where we want to be to with whom we want to be. A shift happens. Yes, a shift happens. A shift in focus from what we want to do to how we want to be. Once this shift happens, not just as a result of a university student project, but also when we have to really face death, then we can move from focusing on doing to becoming to being. This is evolving. In the present context, evolving is nothing but moving from me and mine to we and us, both when we are alive and even after death. I can see the quizzical look. I can understand when we are alive, but how? How even after death? The answer is, it's in the Advanced Care Directive, which also includes decision about organ donation. While we decide to donate even after death, it is the ultimate service that one can provide, hoping and wishing to benefit another person or even the entire humanity. I would like to end my talk with a spiritual twist. Our culture underscores the value of putting others first and of being service-minded. Swami Vivekananda expresses that our nation is built on two great values of Tyaga and Seva. Or as Mahatma Gandhi believed in self-sacrifice and courage to die for truth. These ideals can only be pursued through knowledge and self-effort. Ultimately, at an individual level, it is the self-knowledge and effort that rids us of suffering and fear. Yes, surely it is the knowledge of death that empowers and enlivens us to lead a life of vigor and zest while we are still alive. I would like to end with these next two quotes. One of Mahatma Gandhiji. Live as if you were to die tomorrow. Live as if you were to die tomorrow. But learn as if you were to live forever. Finally, it's not about good death, but living a good life all the way to the very end with meaningful, loving and kind relationships here and hereafter. Thank you.